Sure, you can go ahead and, yeah.
Okay, great. Good afternoon, everyone. On this great fall day, isn't it nice to have some of the leaves changing down here and the breeze is blowing? I'm going to call this meeting to order. It is now 3:30. And the very first thing we do, of course, is to, why don't we do a roll call? And then we won't have to do it again, Lindsay.
Okay.
If everyone is signed on.
I don't see Sarah Lampy,
No.
but maybe we'll just wait until after.
Yeah, that's fine.
After. Okay.
Yeah, that's fine. Let's go ahead and just get started. The very first thing I want to do is to welcome our language justice folks. We have Alejandro and Luis. I think, Luis, you're going to help participate.
Yes, thank you very much.
Well, thank
hello,
you for
everyone.
being here.
Of course, thank you for having us once again. As always, we do want to practice language justice in this space. My name is Alejandro, and I'm with my colleague Luis. We will both be interpreting today in English and Spanish. So I'm going to go ahead and provide these instructions in Spanish first, and then I'll come back and repeat them in English in just a moment. So thank you for your patience.
Thank you.
Hola a todos, mi nombre es Alejandro Arriete, estoy aquí con mi colega Luis Gómez. En este espacio queremos practicar la justicia del lenguaje usando la interpretación simultánea. Entonces, si usted prefiere escuchar en español, después de que repita estas instrucciones en inglés, van a ver un icono terráqueo, un mundo o globo aparecer en la parte de abajo a mano derecha en su pantalla. Cuando aparezca eso, asegúrese de hacerle clic o seleccionarlo para escoger el español. Si ha ingresado a la reunión usando un dispositivo móvil como tableta o celular, verá la opción de la interpretación en el menú con los tres puntitos que dice más o en inglés more. Voy a repetir esto en inglés y de ahí les regresamos su tiempo para comenzar. All right, so thank you for your patience there. As I was saying, we will be providing interpretation in English and Spanish. So if you're not fluently bilingual in both English and Spanish, after these instructions, you'll see a globe icon appear on the bottom right-hand side of your screen. At that point, make sure you go ahead and click on it and select English as your preferred language. And if you've joined using a tablet or a cell phone, some sort of mobile device, you might see the interpretation feature under the three-dot menu that says more. Either way, go ahead and make sure you select your language in just a moment. With that, I'll pass it over to our host to turn on the interpretation. Vamos a comenzar.
Thank you. Is everyone signed in to where they want to be? Okay, we are going to jump right into this is the study session. And of course, everyone knows that during the study session, it is just for the staff to do updates for the board. We don't have public testimony during that phase. All public testimony goes to the business meeting, which starts at 4. But everyone is, of course, welcome to sit in on this. So with that, I'm going to turn it over to Jamie and Jeanette. You have a presentation for us, I believe, on the COVID-19 recovery.
Yes, good afternoon. My name is Anjanette Hawkins, and I am the Emergency Preparedness and Response Coordinator here at Jefferson County Public Health. We are here today to update the Board of Health on our emergency operations plan and our recovery plan. So we'll start with the recovery plan. I'll let Jamie introduce herself, and then she'll move into her presentation after the public health emergency operations plan.
Thank you.
Hi, everyone. I'm Jamie Aberley. I work with Anjanette, and again, Alianza will be doing recovery after Anjanette's presentation.
Welcome.
All right. So to begin, a little background on this update is that all local public health agencies, emergency preparedness and response programs are required through the State Board of Health Rules 6 CCR 1009-5 to update the Board of Health on the FEOP every 3 years. So even though this is a requirement to update you, we also believe it is very important that you are familiar with this document, as we will follow it when incidents occur. All right, so we'll start with the purpose of the document. The Public Health Emergency Operations Plan, we call it the FEOP. So the purpose of the FEOP is to describe the basic strategies and mechanisms by which JCPH will prepare, prevent, protect against, quickly respond to, and recover from all hazardous emergencies, particularly those whose scale, timing, or unpredictability threatens to overwhelm routine activities. These processes are the same for all public health hazards, to include infectious disease outbreaks, environmental health hazards, natural disasters, and any other threats to the public's health. The scope of the FEOP applies to incidents that may impact the health of the public within Jefferson County and when JCPH has the authority to respond to the incident. Our authority comes from Colorado revised statutes specifically outlining the powers and duties of the health department, specifically to public health incident and essential core public health services that could be impacted during an incident. The Jefferson County Comprehensive Emergency Management Plan, or CEMP, designates Jefferson County Public Health as the lead agency for Emergency Support Function 8, known as Public Health and Medical. And in this role, we are responsible for coordinating and supporting public health emergency response actions in Jefferson County when an incident occurs. Declaring a public health emergency in Jefferson County is after an emergency declaration has occurred. The declaration is focused on if the incident could impact or currently impacts the health of the community and or the medical system. Declaring a public health emergency opens up additional policies, funding, resources, and response support to respond more efficiently to the incident. However, in order for us to be able to declare a public health emergency, we first have to activate the FEOP, then assess the damage and concerns that we may have or that could impact the public health system. Okay, so the FEOP is organized into two parts. The first is the concept of operations, and the second is the plan annex. The concept of operations include the prepare, prevent, and protect phases, and this refers to the period before the incident occurs. So it begins when potential threats to public health have been identified based on past experience, general knowledge of the area. It could be based on our hazard and vulnerability assessments that we conduct every 3 years. And JCPH methodically anticipates potential incidents and directs our efforts to help the community prepare, prevent, and protect against those hazards. Some examples of our preparedness steps would be completing or creating emergency plans for the community and for our agency. Prevent examples would be flu shots to prevent or reduce the impact of seasonal influenza. And our protect examples could be personal protective equipment, our personal protective equipment cache that can be utilized in an all hazard response. Our respond section refers to the initial and continuous activities that occur during an incident and are the direct result are the direct result of the incident. So this could be providing mass prophylaxis to the community because of an anthrax attack. The response phase begins at the identification of the incident and is always driven by the incident objectives. So JCPH's incident response begins with the direction of our executive director or their designee. Our recovery, which Jamie will go more into later, addresses the steps that can be taken so that the agency, individual, and community are able to return to the normal state of health, mind, or strength. So example of that would be well water testing after a flood to make sure that all of our well water is sufficient for drinking and using. Recovery, which Jamie will go further into, begins with the response still occurring, but continues long after the response has concluded. Our second piece of the FEOP are our annexes. So we develop and update the FEOP and accompanying annexes to help prepare for incidents. So topics for these annexes are plans that are selected based on our risk assessment, lessons learned from previous incidents, national, statewide, local, or they're recommended by the Center for Disease Control, CDC, and our public health emergency preparedness capabilities. So we have recently created this draft visual of all of our annexes to see which annexes are connected to which appendices, policies, guides, and job aids. I have asked that the Board of Health be provided with a PDF version of this so that you can review it a little bit closer than what's on this slide. But JCPH's FEOPS annexes are divided into two groups. Those that need executive director's approval to activate, we call those response annexes. And then those that do not need executive approval, and we call those ongoing annexes. Our response annexes are our continuity of operations, mass dispensing and distribution, and medical search. Then our ongoing annexes are community containment, epidemiological investigation, disease-specific appendices, health alert network, internal and external emergency contacts, internal information and communications, our clinic annex, legal annex, public information and communications, training and exercise, and our volunteer. When these plans are updated and are changed, we test them out by going through a series of exercises to validate the plans and updates, to validate the policies, our roles, our responsibility, and to validate that our trainings are sufficient for response. So when we have our exercises, we test the capabilities of the agencies involved. We identify gaps through a gap analysis to identify those deficiencies and problems in our current plan. The exercises also allow us to familiarize participants with the plans and procedures through low stress activities. And they prepare our planning team to coordinate with our local, state, and federal partners. They also help enhance collaboration, and increase the confidence of the team by strengthening their ability to respond to an emergency. So if a public health incident is identified that is either impacting or expecting to impact Jefferson County, then the decision to process to activate the FEOP will begin. So we activate the FEOP based on the conclusion that routine program activities, organizational relationships, resources, healthcare entities don't have enough resources to respond. Or we may activate if it's deemed to be in the best interest of JCPH to operate in a different manner than normal. So over the past few years, we have been developing our activation levels for response. As we won't just go straight into a full activation with every incident. We've created this table that visually demonstrates our different activation levels, beginning with the green under normal operations, which is where the team completes daily activities associated with preparedness and response capacities. Our awareness is where we maintain or increase situational awareness around the potential incident. This includes general information sharing and communication with other JCPH divisions. And these activities do not require an activation request. Our monitoring phase, which is you see in orange, is when other health and medical response coordination groups might be affected. So our hospitals, EMS, our state health department, where we monitor the events taking place. During this time, we also provide situational awareness to our partners. Our newly created, which unfortunately, is not on this visual, is a partial activation, where it's the EPR team actively connecting with partners and resources. Even though we have not been officially activated by the EOC, it's just connecting that information, situational awareness with partners that might be affected by the incident. And then finally, the last one, or second to last one, RED, activation and operations, whereas we notify divisions that we are activated and set up and coordinate conference calls with relevant partners, coordinate with other health and medical response coordination groups, activate plans if needed. The last of our response is demobilization, which is where the communities no longer need full support from JCPH, and we've moved into that recovery phase. So these activation levels have really allowed us to manage current events more efficiently. Our current status is we are aware of 6 events within the nation, Colorado region, state, monitoring 9 events, and knocking on wood, we are not partially or fully activated for anything at the moment. So I'm going to knock on some wood and hope nothing happens this week. I talked about earlier that if we update or change any plans, that we test the plans with a series of exercises. And this is something we do on a regular basis. And I also want to let you know that we do have an exercise coming up in Q2 of 2024. And we would like to invite the Board of Health to an opportunity to see what our exercises are like and to get involved with the exercise. So save the date invitation will be coming your way, and we hope that you can come and observe our exercise processes and see what we do on a normal basis when we're testing our plans. So in order to best help the community recover, we conduct a needs assessment based on the availability of resources, severity of the incident, and the extent of the expected recovery. We also solicit feedback from the community during recovery efforts to ensure that their needs are being met and identify any unmet needs. All feedback from incident debriefs are conducted, and this is where we during demobilization, where we talk with the responders, get qualitative and quantitative data during demobilization and collect that and use that as a guide for our improvement plan and areas of success. And the goal of recovery is, of course, to restore public health services as quickly as possible post-incident to support any recovery efforts. So what's new? We are taking lessons learned from COVID, from statewide, regional, and local real-world incidents, such as the Marshall Fire, and we are reimagining ways that our FIOP can be more robust. So some of those pieces is we are participating or co-facilitating a statewide FIOP work group to identify best practices for our emergency operations plan and its annexes, and identify how our emergency operations plan and annexes can continuously be improved. We're updating our emergency declaration process by adding our division director, Christine Billings, into the process and determining the best activation and declaration processes. And our FIOP has always tried to focus on an all hazards and whole community approach, but COVID taught us that we need to reach further with our whole community interactions by having subject matter experts in different seasons of life review our FIOP and plans and identify more gaps and things that we might need to consider when responding to an incident, such as our older adult population will have different response needs than a teenager or parents with little kids, or different response need than a single parent or a person with access and functional needs. So we are truly digging deeper into that whole community approach for our plans. So as we reviewed earlier, putting our FIOP and our plans in a visual was an incredible action as it provided us with a way to review all of our plans, appendices and policies, job aids, anything relevant to each of the annexes, And by doing this, we were able to combine some of them, reorganize our annexes and appendices, and advance our preparedness and response efforts to identify which ones we need to build up more. And that's what we are doing now. So I will hand this off to Jamie. Thank you so much for your time.
Thank you, Anjanette. Again, my name is Jamie Aberly, and I am the COVID-19 response and recovery specialist for Jefferson County. And this is a new role to me, and I'm kind of learning as we're going. Recovery tends to be something like an appendix Z, and we're trying to bring it closer to like a appendix Z or a C, not Z. Next slide, please. So the severity and scale of the COVID-19 pandemic, as well as the needed steps for mitigation, resulted in significant changes to how Jefferson County lives, works, and plays. And we're all experiencing the new normals of that 3 years into the pandemic. And just like any other life-changing event, there's going to be a before and after. And unlike other disasters, most of the impacts from COVID-19 are unseen. And the pandemic also exacerbated many issues, as we all know, such as race disparities, mental health care, and information and communication barriers that really tax the medical system. So we are in a vulnerable state of skipping recovery due to just being, ready to move on. But to do so would really lose sight of the lessons learned, allowing us to respond better to future emergency events in a better way. Next slide, please. So recovery, just a straight up definition out of Oxford language, is a return to a normal state of health, mind, or strength. From FEMA, the goal of the recovery phase is to bring the affected area back to some degree of normalcy, and also to consider what would lessen, the effects of future disasters. What can we do better in the future? Next slide, please. And again, as I said, it's often overlooked in planning. Here, this is a graph. This is from the FEMA's National Disaster Recovery Framework. This was written in 2016, but it's still been a really great resource. I think it could be rewritten now since the pandemic happened to include more health aspects, because you can see a disaster, even though it's short, we actually want to prepare for it beforehand. And then, as you can see, then you have the actual disaster event, and then a very, very long time after that for short-term and long-term recovery aspects. So if we look at the disaster, which COVID-19 was declared a disaster, it was also declared an emergency, but it was also declared a disaster. It's at least 3 years long, the actual emergency was. So we can expect recovery to be taking quite many years ahead of even 3 years for us to finish and complete recovery. So with that being said, with all the research I've been doing, not a lot of people right now are doing recovery for this. So we're striving to be a model in Colorado for public health disaster recovery planning. And my goal is for, once we get this completed, is to help other organizations, other LPHAs to build a recovery plan. And it will also be a template for an all hazards recovery plan, because pre-disaster recovery is very important. It helps actually speed up the actual recovery, and it supports that long-term and short-term planning. So we want to have a recovery plan set up ahead of time, and this will be a great template for that, because again, it's something we really have never done before for, public health recovery. Next slide, please. Some of the themes, for examples of, what we're going to be looking at are what essential services were disrupted. Have any of those still dropped off? What do we need to get back on? What were the health outcome inequities around the county? What did stay-at-home orders do to people's health, schools closures, business impacts? all of those, what impacts to community health were those? And then we all know that mental health is going to be a big one. We're also looking at youth voices in older adult populations. Again, I think this is a big one that we all know about, but the healthcare worker deficit and burnout. We had a large amount of people leave the healthcare industry, not quite ready to retire, but did retire. We lost a lot of their a lot of their knowledge. A lot of that institutional knowledge was lost when they left. How do we get that back? And how do we maintain that when people do leave? And then also, again, pandemic response for future pandemic responses. Next slide, please. So our desired outcomes from this recovery plan is to be ready and prepared for the next pandemic, have COVID-19 fully integrated into our activities, and adjusted to the new normals. And as public health, what can we improve on? What can we improve on? What changes do we want? And are those changes possible? The time is now to really figure that out. We can start doing things even in a new way if we want. And then it's super important just to celebrate the successes of what went well. We have, even in just local public health, we have done a lot. We've been beaten up a little bit. But some people have wanted to leave. We want to make sure that we're celebrating all the hard work we did, the 3 years of really hard work that we did. Next slide, please. So what will our post-COVID-19 area look like at JCPH? It's really up for the community to find that out. This has to be whole community focused. That includes local, state, tribal, territorial, insular governments, nonprofits, NGOs, volunteer agencies, the private sectors, children and older adults, individuals living with intellectual and developmental disabilities, those from religious, racial, and ethnically diverse backgrounds, and people with limited English proficiency. I think one of the big recovery themes is going to be health equity. We saw that in action. We know that a lot of other people of different races and colors were treated differently. They had lower health outcomes. So what can we do better? This is really a good opportunity to step that game up. And that participation will foster better coordination and working relationships. And we did really great working with our partners. That was one of our successes. But a lot of those partners left because they were burned out from COVID. So we need to get back out there and rebuild those relationships. And it will help promote a successful recovery. Next slide, please. So our next steps is to roadshow this charter, gain our buy-in, build those relationships with our partners and communities. That takes time. And we are currently working on completing our after action reports. From there, we're going to initiate those focus groups and community conversations as well as committees. We'll finalize our recovery themes. From there, we can, evaluate the issues, what we want, determine priorities, engage partners, identify and coordinate key researches, and again, expand past COVID-19 for future recovery efforts. And that's something I'm really proud that Jefferson County can be a leader in. I think we really are stepping up the game. I believe we may be the only county working on this at the moment. So having that public all health hazards recovery, again, it needs something we need to be doing before recovery or before an event anyways. So we're getting on track with that. And I believe that's it. That is all I have. Thank you for your time, everyone.
Does anybody have any
Thank
questions?
you for your time. Board members, do you have questions? Do I see any hands going up? Up. Yep, there's Lane Drager. Go ahead, Lane.
Thanks so much for that. I appreciate the effort. I think there is definitely a need to make those stronger connections to what we do in public health. You know, that COVID is what put us on the map for some people, unfortunately. But I think the efforts that you're doing are really important to rebuild some of those relationships. You know, our healthcare industry was pretty decimated from this, and we've seen losses in public health too because of just the stress on people for so long. So, you know, we really need to make sure that the new people coming into this are strong partners and that we rejuvenate ourselves. So I appreciate that sentiment too. Celebrate all the work and successes, because there's a lot of successes from what work all of you did.
Thanks.
Thank you.
Thank you, Lane. Any other questions or comments? Well, we want to thank you for bringing this forward. It is a discussion, and you know, when you're talking about, you know, recovery, it's from all of the hazardous stuff that has, you know, gone on, and everything from the fires to the pandemic to, oh, it's just, it seems endless. It's been a rough 3 years, hasn't it?
Yeah.
Well, we appreciate you all. We very much appreciate our staff. Thank you.
Thank you very much.
Okay, and that will bring to an end the study session portion, and we can go right into the business portion. At this point, we will do a roll call. Lindsay?
Sure. Sarah Lampe.
Here.
Harriet Hall. Is that a here? Sorry, Harriet. I was thinking, but I didn't hear anything. Okay, great. Thanks. Blaine Drager
Present.
and Sherry John.
Here.
And for the record, Rochelle Woods is absent and the quorum has been established.
Well, the very first thing that I want to do is welcome Sarah Lampe to the board. This is her first meeting. Glad that you can be here. I know when I started, it took a while for me to kind of catch on to what the rhythm was, but I know that you've been around the public health for quite some time. We're just thrilled to have you on the board. So welcome. Thank you.
Thank you. Glad to be here.
Well, we're glad to fill this spot too. And Rochelle wanted to be here, of course, but you know, she took off on a little vacation. We're just not going to tell anybody. Oh, is this public? Oh dear. Okay. Let's move right on. And we are continuing, of course, the language justice. Alejandro and Luis, I'm assuming. Let's see. Let's go right into the consent agenda. Is there anything that's anyone wants to question or have questions on or remove from the consent agenda that should be discussed? Okay, then I will ask for a motion to move the consent agenda forward, and we'll have a vote.
I'll move to approve the consent agenda.
I'll second that.
Thank you. Is there any further discussion? Seeing none. All those in favor, please say aye.
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 Opposed? Hearing none, that motion passes. And the next portion is public comment, and my understanding is we have two people that have signed up, and I think the order that they had signed up was Mr. Mike Muller and Anita Springsteen. And Mike, I believe that you had signed up first. And let me just say that when we're doing public comment, we do have to take a limit to the time so that we can make sure to get through our agenda in a timely manner. So we do ask the people that are speaking if they would just keep it to 2 to 3 minutes. And this is a chance for the board to listen and take notes, and not have, we don't go into a big dialogue with the folks that are presenting. So we're here to listen. And Mr. Muller, are you
You'll get it.
on? Or is it Anita first?
It doesn't matter.
Whichever you prefer.
Well, why don't I go ahead and this is more information than public comment.
Okay, so you know what I forgot to do? Please forgive me. Would you state your full name and your address, just so that we have it in our records.
Well, I'll give you my full name, but I really don't want to put my address out there. I'm sorry.
Okay.
And what I did was I got a phone call from Jefferson County Health saying that I needed 4 inoculations to get me up to current. And I said, well, how did you get the information that I need 4 inoculations? And they said, well, I'm with the Jefferson County Health Department and we just keep track of that. And I was supposed to get a shingles shot, a COVID shot, a pneumonia shot, and a flu shot. And then I said, well, can I check with the health department, and can you give me a phone number and your contact name so I can get a hold of you and find out how you got this information? And lo and behold, guess what? That number was blocked. It was, and I called the number back and it was not available. Someone had gotten a list of my inoculations from Jefferson County and were calling saying that I needed these inoculations. Number 2 thing was that when I came down to get a CORA request, nobody knew what I was talking about. I wanted to find out who had access to my records. And nobody would give me any information on who had access to my records. And then I asked them if they had any HIPAA training at all. Now, these people that work for the Jefferson County Health Department can access your Social Security numbers, your family histories, your health report, all these different things, and they have no HIPAA training. And I'm kind of shocked on how in the world can the health department not have HIPAA training on private information that they can get into. Well, I did some more investigating, and somebody has taken a flash drive of all the inoculations reports and has sold it. This is the only thing I can come up with. And the only 2 names that I've heard so far is either a Johnston or Johnson has sold this information. And I was wondering if health department had any employees named that. I couldn't get an answer on that. And then because this HIPAA training thing is so important, how can you not have people that have no background checks have all the information in the world with my Social Security number, your Social Security numbers, all your history, your family history, and not have the training on HIPAA and have no background checks? How is this possible?
Okay, and we're at time there.
Okay.
Gary.
The one thing I would say is, obviously, we don't get into a back and forth dialogue, and we're just hearing about this. So I would definitely encourage you to be in touch with the legal department, for the county. The attorney that usually works with the health department is a gal by the name of Carrie. So if you get your information to Lindsay, she can get you the information that you would need. Anita, I think you're also signed up to speak.
Yes. So I was mainly assisting Mr. Mueller in trying to sort of dig into this and get more information. We wanted to alert you all to the issue, and I had concerns about the lack of HIPAA training and seemingly some security issues as far as people's information. So I just wanted to make sure that you all were aware of that, and we're trying to dig in and get a little more information. We will check with the legal department, but I think it's very concerning that, what it appears is that somebody outside, like a subcontractor or a pharmaceutical company, was calling to ask Mr. Mueller to get his inoculations, and that's what he's concerned about. So thank you for listening to us, and hopefully we can get to the bottom of it.
We both appreciate your time and listening to us because I'm very concerned about it.
Okay. Well, thank you both for bringing that to our attention. And again, please do reach out and get the proper contact information so that you can, have a discussion with the legal side of things. Okay. Let's see. Let's move right on to the financial report. Salma, are you there?
Yes, sharing my screen. And can you see my screen? Awesome. Hello, everyone. For those of you who don't know me, my name is Salma Jakan, and I am the accounting supervisor here at Jefferson County Public Health. And today I will be presenting the September financial statements. As of this reporting cycle, and with 75% of the year complete, our total revenues are being reported at 70% of the annual budget, so below budget by 5%, and this is primarily due to our grant funding. Unfortunately, we are not expecting to fully utilize the remaining $4 million by the end of the year due to the fact that we are shifting away from emergency response into routine inspection and case investigation. So we were not able to utilize our ELC grant, and also the limited nature of in which we could spend the funds made it really challenging to fully utilize the award amount. In terms of our expenditures, they are being reported at 69% of the annual budget. And again, this is because of salaries and benefits associated with our ELC grant. We are also shifting some of the salaries and benefits associated with investigation and routine investigation and recovery into the county ARPA fund, which is not part of our public health fund. So we are shifting some of those salaries to the county. In terms of supplies and direct assistance, we surpassed our line item. Other charges and services, they are reported at 75% of the annual budget, so on track with the budget. Capital projects and equipment are currently being reported at 10% of the annual budget, and we do have some pending IT infrastructure upgrades, and we should see those charges hitting in the next few months. Intergovernmental charges are being reported at 93%, and interdepartmental charges are being reported at 78% of the annual budget, and this line is basically cost allocation. As of today, we've utilized 67% of the county transfer allocated to the department, and we are anticipating that we would fully utilize the county transfer by the end of the year. That's all I have for today, unless if you have any questions.
I have a quick question.
Sure.
Would you just go back and remind me, with all of the acronyms out there, would you talk a little bit more about the ELC grant? And you said that we weren't able to spend it all. Would you tell me, kind of refresh me on that, please?
Sure. So the ELC, I think it's Enhanced Laboratory something. I can look that and I'm not sure if Christine is here. So basically, it's one of our major emergency response award that we received 3 years ago. We had ELC 1 and then ELC 2, and we were awarded pretty much 10 million, and we had budgeted that we would utilize half of it this year, but unfortunately we are unable to do so. We were unable to do so due to the limitations that exist within that award, and also the fact that we are shifting from emergency response into like routine investigation, and we're no longer doing testing and things like that.
Okay, thank you.
Thank you.
Are there other questions for Salma from the board members? Okay. If there's no other questions, can we get a motion to approve?
I'll move to approve the financial report.
We have a motion.
Second that.
And there is a second. Is there any further discussion or questions? Seeing none, let's vote. The motion is before us. All those in favor, please say aye.
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 Aye. Any opposed? Hearing none, the motion passes. Okay.
Thank you.
Now we are going to move to new business, and thank you, Salma. We're going to move to the new business, and we're excited to have a update from the Board of Health work session that we were all a part of from the Otawi group. And I do believe, who is presenting today? Sarah, are you?
Yeah, hi.
Okay.
Hi, everybody. Sarah Miller, and I'll be presenting alongside Amy. Amy, are you on the call? I can't see you.
Yes, I am.
Oh, there she
hi,
is.
Amy. Great. And we're both from Ottawi Group, and we were with you at your strategic planning session. So it'll be the two of us. I'm trying to share my screen. Can somebody let me know if you are seeing screen?
We are.
We
Yeah.
can see it, Sarah, but you need to do the slideshow view.
Okay,
Right.
thank you.
You go to view.
Thank you. Sorry about that. So hi, everyone. Nice to be with you again today. And thank you for giving us, we're going to take about a half an hour of your time today. And I also need to apologize. I'm at the end of an illness. And so I cough every once in a while. I try to get to the mute button as soon as I can, but it's often a failure on my part. So just extending my apologies for that as we move forward. So we are presenting in your board packet that you received last week was our final report that summarized your meeting and your outcomes and decision items and discussion items for the future that you had articulated throughout the day. And so today we're going to be going not through the report. We're under the assumption that you have read the report, and we are going to go through a just an exercise of sharing with you the high level information in the report and spend the majority of our time today talking about what are some of the next steps and action plans that you would like to see. So I'm going to turn it over to Amy, who is with us. And Amy, take it away. Oh, you're on mute right now. Yep.
Great. Just to recap, y'all met on June 22nd for a study session. We conducted one-on-one interviews with all of you ahead of time to understand more about what you wanted to cover. And we then created an agenda based on what we learned from you. And we also asked you to do a little bit of pre-work ahead of that study session. So thank you for doing that. Since then, we developed the action plan that was reviewed by Dr. Story, Jeff, and 2 board members, and incorporated some of that feedback. And just to remind you that at that study session, you talked about options, you talked about ideas, but didn't come to any formal actions because that would need to happen in a public meeting. So if you go to the next slide, Sarah. We heard a lot of information at that study session. There was a lot of engagement and participation. And so what the Ottawi team has done since then is we took all of that, we synthesized it, and came up with about 7 key themes that we heard there. Management of the ED and what that looks like moving forward. Fiscal oversight was a topic that a lot of you had some ideas about for moving forward, as was community engagement. You also had a presentation about your role in state, municipal, and county policies. We talked about strategy and planning, ways to engage staff, and finally, training and onboarding for new board members. So the action plan, if you go to the next slide, Sarah, really takes all of these key themes and synthesizes them. We provided you some background about why they were important and topical for the study session, as well as options that we heard you were interested in considering. You'll also see in that action plan some specific follow-up that staff committed to engaging in. So as I mentioned, the plan's been reviewed by a couple of board members, Jeff and Dr. Story. And in just a few minutes, my colleague Sarah is going to facilitate a session on next steps and how do we operationalize that. But before we do that, we wanted to check in with you and see if you have feedback or reactions to that report that we distributed.
Board members, are there questions or reactions, as Amy has said, to the report and the recommendations? Okay. I'm not seeing any.
All right. The next slide really highlights the fact that the staff have been really busy since you all met. They heard a lot of the some of the follow-up items, and they have been moving forward with some of them. And so we've just highlighted some of the items that are completed or in process that came up at the at the staff level at your study session. So we divided this. You see some, I won't go through all of the bullets here, but you can see that there's been action on fiscal oversight, work in the area of policy, strategy and planning, and then a number of tools have been distributed or are in development that we've listed here, and you can see the status of those. So a lot of things are ongoing, and folks are busy following up on that. And then one of the things that came up pretty frequently at our one-on-one meetings with you was having more information on Board of Health members gathering for non-business related activities. And so I know that that's something that has been addressed in executive session as well. So number of things moving forward since you all met. Any comments or questions on that before I hand it over to Sarah to facilitate a discussion on some of your next steps?
I'm not seeing any hands go up, Amy.
Okay. Sarah, you're muted.
You'd think I'd learn by now, but I have not. Thank you for the opportunity. Thank you, Amy, for getting us teed up for this next discussion. I want to take the opportunity to deeply thank the senior leadership team members who also came to the end of your meeting when we all met, and for your work in these in-between spaces and the heavy work that you did that throughout that day. It was paramount and led to our being able to make the recommendations that we are about to facilitate you through. So I want to start with reviewing over the slides, and then we're gonna have a discussion around some thoughts and next steps that you would like to take as the board. So we have been working with Dr. Story and Jeff in particular to think about where they might suggest and where they think the priorities should lie as far as attacking the action plan and where the priorities might want to be. And those are the three areas of fiscal oversight, community engagement, and policy work. I want to rewind a little bit to community engagement. The CHIP, which is the Community Health Improvement Plan, is one of the top priorities that is going on right now. And there is a need for a Board of Health champion to be walking alongside the staff to maybe help drive from that governance standpoint the CHIP priorities and looking at the CHIP as we move forward. And then there is some deep progress being made on a countywide tracking system of goal progress that has happened. So it could be a clear communication stream both to you as well as to your residents to be able to understand progress being made with the Community Health Improvement Plan. Some action suggestions that we bring forward from Ottawa are to use a little bit of today to think about implementation strategy. Specifically, we'd like to have you think today about having a conversation about what are your desired outputs now that you have this action plan or this summary document in place. Where would you like to take it next as a governing board? And where would you like to be starting your work? And it can be multi-starts in different areas. And then really think about defining some next steps and articulating some high-level timelines so that we can help move you forward, and your senior leadership team can help with that as well. You also mentioned of scheduling another half-day follow-up and planning session to maybe assist with these items, or doing some roll up your sleeves and work a little bit activities. And so that was articulated pretty clearly in the meeting near the end of the meeting, saying successful meeting, we need to make it a priority to do this again, and maybe not at that length of a day long, but a shortened day to do some work. And so I'm going to start with cultivating from you, if you can react to this question of, now that you have this action, this summary document in front of you, what are some desired outputs that you would like to see? They could be in alignment with the priorities suggested by the staff team, or it could be something else that's on your mind. But I'd like each of you to talk with me a little bit about what are some of the priorities that you're interested in moving forward, and outputs that you would like to see. So who would like to take the courageous first step in chatting about that? Lane, I see you came off.
There he is. I was just looking for Lane because I knew he had a.
Thank you so much for this. I would like to start to move us to discussion and action, because I think there's some important pieces. I also want to connect the dots. For me, looking at this fiscal oversight is connected to how we do our public health improvement plans, our community health improvement planning processes. So as we're identifying priorities, we need to be budgeting those priorities. So those are, to me, very interrelated, and we need to do that. I also want to make sure that we're staying at an appropriate level as the Board of Health and giving sort of guidance and vision. So to me, that fiscal oversight is budget level. We talked about, reviewing an annual audit versus monthly approving warrants of every expenditure that the health department does. So really staying at an appropriate level for being that steward of the county's money, all the residents' money, but not getting into weeds that are really not useful and helpful. And then again, same with our policy focus efforts. Those need to also be connected back to our priorities, and making sure staff have support from the board to be engaging and working in the efforts that are important to our community.
Thanks, Lane. Can I hear any reactions to what Lane has, either agreement or additions or questions?
Well, in my opinion, I really think that Lane pretty well hit the nail on the head. I think that having the fiscal oversight in more of a understanding, kind of format, painting pictures as to how does it apply? Because sometimes, we see the fiscal numbers and all of that, but how does it really apply so that, people can just understand it? You don't have to be an attorney, you don't have to be an accountant, you don't have to be, somebody special. But it definitely ties to the budgeting and what the priorities are. So I think just a more clear understanding of, what those priorities are and how it works with the fiscal stuff. And then the community engagement, of course, I know is important to all of the board members. I think that in that we definitely need to have more discussion, because it's, how do you do community engagement? What does that actually look like? And I think that's where we need to have conversations as to, what direction would it go? What does it look like? And then there's a Board of Health champion needed. And I guess I'm not clear on that.
Yeah, that's a request that we gathered from some of your staff.
Right.
Saying that if they could have a Board of Health member that would like to really dive deeper into conversations about appropriate roles of Board of Health within the community engagement work that your Jeffco public health team already is doing and is doing really well. And then how do we utilize the board more effectively for community engagement, whether it be with meetings or I just don't know. I'm making stuff up right now, but it was a request to try to see if we can get an assignment from the Board of Health that might be able to engage on a deeper conversation around community engagement. Much to what Lane was just referring to about ensuring we've got appropriate roles articulated, and staying in the right space of governance, but helping, because you all had a lot of community engagement questions and it came up, and how do we get that for you and utilize you appropriately in your roles?
Yeah, thank you. Yeah, that definitely needs to be on the.
Harriet, I see your hand up.
Yeah, so just a comment about the community engagement and the community engagement or the community health improvement plan and the whole idea of a Board of Health champion. I think that's a great idea. I think it's going to be hard for any of us to be that champion at this point because we've had so little involvement with that plan as it was developed. And, you know, so we could be like a champion in name only and, you know, kind of, you know, a cheerleader maybe, but you're a much better champion when you, you know, both understand and kind of have some investment in what you're championing. And I think right now that's not something that at least I feel like I could do very well, even though I have a real interest in community engagement in that area of community engagement. So just that comment about that. I don't know if we want to leave the community engagement one and go on. I wanted to make a comment about policy as well.
Please go. Yep.
So I think that policy and what's policy and what's the appropriate policy role for a board and the difference between policy and operations and the way they overlap, et cetera, are difficult issues often for boards. Sarah and I had coffee yesterday and we were talking about this, how, you know, how that's really one of the things that I think requires quite a lot of work. And I think we need to put some energy into that area as well. And it hasn't been mentioned yet. So wanted to say that.
Yeah, thank you. And I do know, as you remember, Kelly Curl was at your meeting and presented a really thoughtful sort of potential framework that I know that she is being very intentional. I think she might even be with us today to listen to your thoughts on that and make sure that she's shaping a way to engage with you all as the board at that policy level. So I know that she's been tapped and if not anointed to generate some potential pathways to have that happen. So great. Sarah, I see your hand up.
Hi, it's lovely to see you.
Thank you, you too.
So my question's actually just a point of clarification on the Board of Health champion position. Is the intention for there to be a champion on community engagement efforts for the organization, or is it the intention for a Board of Health champion to be for the CHIP process? My reading and interpretation of this is to garner support for a Board of Health champion for community engagement efforts who can support across the department in those, not necessarily on the CHIP itself. So if you could provide clarification there, that might help us understand where and what role that is, because I think Harriet's point is well taken, and I didn't read it that way.
Thank you. I'm going to ask if there's any memory that might be clear from Amy and Lane. I saw your hand up, and I don't know if we can ask for engagement from Sarah or Jeff, because I know they had some thinking around this too, but I wasn't sure if that's appropriate to do at this point.
I I thought it was getting some engagement around the chip, but I think that would be like more appropriate for Dr. Story to weigh in, because I know that's something that she's been thinking about.
Blaine, any thoughts on this?
I don't have answers to that. I guess my suggestion is this, I think, is a good topic, maybe even for a study session for our next meeting, but
Okay.
to have more insight from staff on what would be helpful. I think sort of a lone champion, I don't know if that's even appropriate, but it may make sense that we're looking for how can the board members each be involved more, and again, plugging in where it's more appropriate or stronger interests. I think there's a general interest for the board to have more opportunities to engage with the community, and understanding where those opportunities might be presenting themselves as staff already are organizing things. This was dialogue we had with the commissioners, so we are looking for those opportunities where we can leverage existing situations instead of just creating, here's a Board of Health listening session. We know that the community doesn't have limitless bandwidth either, so we want to try to leverage where we can opportunities, like everyone is trying to come listen and we want to be part of that as well. At least that's me personally. But I think it's important that we're tying it back to some of the processes that we have too. So it does make sense. We're building this plan to improve your health. We need to make sure that it's got the community's voice in it, and that they understand and they agree and they think this is the right direction. To think we know the best for everyone is not what we're trying to do. We need to make sure that that community voice is part of shaping the work that happens, and that they are part of the work that happens as well.
Thank you. And Dr. Story, I see that you have your hand up. Sorry, I know there's a lot of Sarahs involved here, so I'll use our last names.
Thank you. Yeah, I mean, I just want to jump in every time someone says Sarah, then we're all talking at once. I just briefly, and I was going to bring up the chip in my update as well. We are so close to completion, and I do want to at least remind the board of how critical you were to the development, even if it felt like you weren't engaged. It was the conversations at these meetings, it was the community health assessment, it was the board retreat. Like, a lot of that information was taken and fed into the priorities, and now we're going through, and you took a survey, so thank you for doing that, the community kind of gut check on the prioritization of the major health topics. And I do agree with Lane, although you're the board, so do what you please, but I think a specific study session, working session around the county health improvement plan, knowing it, loving it, figuring out how we're going to track it. And I do believe it should be integrated if the board is amenable to more regular updates around the goals and our metrics that we could just touch on maybe in this director's format every board meeting, because it truly is your plan. It is the county's plan, not the health department's plan. We're the facilitator. We have our two main internal champions and conveners are on in the meeting now, Amanda and Myra, and I was talking to them today that the health department's job is to convene, it's to create, it's to track, it's to evaluate. We can't do it alone, and this is your plan as well. So first and foremost, actually. So I'll go back on mute, and I'll be talking to you again in a second anyway. So.
Sarah M., you're on mute.
I appreciate it. Sherry, thank you. I want to acknowledge that we just have about 3 more minutes here that we've been given for this discussion. Sherry, that's up to you about what you want to do with that, but I just want to pay attention to the time, and then I see your hand up, so please.
Well, I just wanted to reiterate that I think having a conversation with the staff to ask them, maybe they could help us define what would that Board of Health champion look like. What is the expectation? It's too vague for me to wrap my arms around.
Okay, perfect. Lane, I feel like you had your hand up maybe for an additional issue too. And was I reading that right, or were you able to talk about everything you wanted to? Okay,
No, I'm good. That I would just wanted to share that idea that a study session to me makes sense to further explore this and make sure we're meeting the needs that staff have, as well
okay,
as expressing what interests the board has.
Yeah, I would totally agree with that.
wonderful. We are going to push you a little bit to get to outlining an action plan per se on some of these items. So I want to just check in on any objection to start with the priorities of fiscal oversight, community engagement, and policy. Any objection to that? I know they're all super important topics that you talked about, but I'm trying to get you to hone in on a handful of them that you can manage over the next months. Okay, I'm not seeing any objection. Lane?
I think we already have. I mean, the other item that we had talked about, I think we're going to be doing today. Somewhat is
Yeah.
the work we have with Dr. Storr to make sure
That's right.
have a thoughtful process of how we're going to manage and set performance standards and all of that. So that to me still is a timely one that we need to. We have a new executive director and we need to make sure we're doing a good job managing.
Yes, we were acknowledging that we could see progress on that, so we wanted to try to focus in on those other areas, knowing that you were going to have executive session and things like that. I want to touch base really quickly on scheduling of another half-day follow-up and planning session. Is that something you want to talk about in the new year? I would just want to set a target date for that because Lindsay, as Lindsay works so hard to get you all together in one place, we want to make sure we kind of give her as much leeway as we can. And we were thinking about looking at that beginning quarter of the first year to have a follow-up session and work session.
I think that's important.
Perfect. So we'll give Lindsay a green light to go ahead and try to start getting that work done. Just as a wrap up, so Amy and I have been diligently taking notes and obviously listening to you all, and we will be doing a sort of a summary of this discussion as well, and trying to layer that on top of discussions with your senior leadership team on, and Sherry, obviously with you as well, on what some next steps might look like. If anything comes up in the meantime, feel free to reach out to Lindsay to making those connections on some feedback and anything. We all know that later in the day when we're just kind of thinking about what we were meeting about, other things come up. So when those things come up with relationship to this, please bring it forward. It's important that we hear from you via Lindsay. Harriet?
So I just want to suggest that, and I bet you've thought of this, but that before we get together, that you all have a meeting with Sarah Lampe to bring her up to speed with that particular meeting and get her thoughts, because I think that's really important. I think onboarding of new board members was another issue we talked about, and it'd be an important thing to do from that perspective.
Okay, we will take that and move that forward with the staffing as well. All right. Any last thoughts as we move away from this? Thank you for letting us speak with you today and keep moving this forward.
I do have one question. I want to be sure that Sarah Lampe has received the documents that you all have provided through this whole process of, the work group that we did, the work session that we had, et cetera, so that she has.
We'll make sure she gets those if she hadn't, the pre-work and all that.
Okay.
Sarah, I'm not sure. We'll just check in with Lindsay on that for you.
Okay.
Lindsay sent me the packet in my orientation packet, and I received it in the Board of Health packet. So I've read through everything. Very helpful.
Thank you.
Thank you.
All right. Well, thank you for your time and energy and commitment to planning for the future. Thank you so much, and enjoyed spending time with you today. Appreciate you all.
Thank you, Sarah, M, and Amy. We appreciate you, both of you, for taking your time.
You bet.
You bet. Thank you.
Thank you. Okay, we are going to move forward. The senior leadership team updates. And I believe we're going to start with Dr. Story.
You are. Lucky you. Yes, you will be starting with me. I turned my video on so you can see me. So I feel like we're we're talking to each other. I'll start. I'm going to just share a couple visuals as I talk. So let's see if this works. I should be able to share my screen, correct? I'm assume.
I'm pretty sure you
We'll
should.
see. We'll see. Just give me 1 second. Let's see if this works. Hold on. Thank you for your patience. Okay, tell me if you can see anything. Yes?
Yes, it's just
Okay.
not in presenter mode.
Got it. Okay. Do you see it in presenter mode or do you see it in full screen?
It's in presenter mode. So
That's what I thought. Okay, so what we want to do is swap. Now?
Okay.
Perfect. Okay, thank you. Okay, just a few things I want to share. And then I'm going to turn it over to a few of my colleagues for some updates. First of all, hello, Dr. Sarah Story, for those of you who are on the call that I don't know or in the meeting that I don't know, the 5 weeks in executive director of the Public Health Department. Thank you to all of the board members who've met for coffee and lunch and calls these last couple of weeks. And I was thinking a lot about coffee with Harriet yesterday. Well, I had tea, she had coffee, she had a latte. Harriet's a gardener, and I thought, one of the things that's been on my mind is that I'm often like so down in the weeds and we're so kind of in these operational excellence issues and all of these decisions that need to be made that I really wanted to step back and just kind of share with you a couple things that are on my mind that are really driving my vision this month, right? There's a couple things this month that just hit me. The first was a study by Dr. Glenn Mays that has been making the rounds with some of my colleagues in other health departments in the region. And it's very wonky, it's very technical, but there are a couple takeaways and I want to share them with you because I think they set up a little bit of like the updates that I have around the CHIP and around clinics and around policy. What they did was assess health departments all over the country, hundreds of health departments, and they characterized these health departments. And what they really wanted to know is in places with health departments that have certain characteristics, do we see people living longer, healthier lives? And I was like really intrigued by that. So they had a couple takeaways. One, strong systems that include really strong community collaborations with health systems, school districts, nonprofits, and strong boards of health. We had lower mortality from preventable conditions. And preventable conditions are really like public health's wheelhouse. And that's like a 7% increase or decrease in the mortality rate, death rate from preventable conditions in strong systems, characterized as strong systems. I thought that was really cool. I think that really validates all the work we're doing around the CHIP, all the work we're doing in trying to build relationships. And I really see that as really a centerpiece for an executive director. They also, this was crazy to me, that these systems in places with strong systems approach where it isn't siloed, we saw the difference between the richest folks' life expectancy and those living well below the poverty level. The gap between that was smaller in places with a stronger system. So another reason why, even though it's hard, like to do the hard things to build these relationships and systems, really we see actual tangible payoffs. And the last I would say, and this is really timely because I met today, had a great meeting with our health equity supervisor internally. Really grateful that this board has adopted like health equity principles, and you'll see a lot more about implementation of plans very, very soon. But departments that have a high focus on health equity have much lower mortality rates, especially for people of color and communities of color. And I think if there's not any more reason to do what we do, like that's it, that's the math behind it. And now here's some local data. And so this is not meant to be heavy. I want to give a very big thank you to Kate Watkins, who is attending the meeting. She is our data science and epi supervisor. And so I came across a graphic in New York Times, Washington Post, something like that, that nationally was showing the steep increase over the last few years in deaths related to alcohol, drugs, and suicide combined. And so Kate, bless her heart, I came to her and I said, can you do this? Can you recreate this for Jefferson County? And she did, and she did it quickly and beautifully. And I thought this is so important. I wanted to bring it to the board. There is no action needed. I just wanted you to see it as one of these things I look at often to remind ourselves why this population health, this prevention approach is really important. You'll see between 2017 and 2021, the number of deaths pretty much double for those combination of things with alcohol, drugs, and suicide. And I just want to make sure that we see this, because it shouldn't be hidden, right? These things shouldn't be hidden. And I think you will see that reflected in our chip when it is complete. And I'm happy to share this with you later. If you want the raw data and you want the data behind it, reach out to Lindsay and we'll make sure that you have this as well. So that was my soapbox on why. Here are some updates, and I'm happy after this little update, I'll just open it up if you have questions for me. Here's some high priority things I know you love to hear about. Our assessment on the future of clinical services is continuing. We are now in phase 2. We've kind of wrapping up understanding the community landscape, and now we're probably going to be focused a little more internally, figuring out our capacity and the vision for what clinical services looks like in this next season of JCPH. I'm very excited. The staff is really excited too. I feel like our visions are aligning, so more on that soon. We talked about the CHIP, the county's health improvement plan. We actually have a big prioritization exercise with some community partners that our staff is leading on Thursday afternoon. I went through it with our internal staff. It's really great. Some very clear themes are emerging, so I'm really excited about where that's going. And again, thank you for completing the survey, for those of you who completed the survey, because we were able to look at your priorities, resident priorities, elected official priorities, and take all of that into consideration. Another kind of big thank you to our policy team and to Kelsey Rivera, who is actually, I believe, on the WIC side of things, for identifying an opportunity for JCPH to publicly comment on the Pregnant Workers Fairness Act, which was open for comment. That link, when I send these slides, that link goes to the Federal Register. It's really about strengthening the protections for postpartum workers, especially those who are choosing to breastfeed and who need accommodations. So thank you, Kelsey, and thank you, Kelly, for bringing that to our attention and making such a beautiful public comment. Tomorrow, we'll be at an EPA media event. So Jim Rada will be at the event with Commissioner Kerr. That's in North Glen. I just want to put that out there so you're not surprised if you see it on the news or anything, but it might be a slow news day if that's headline news. But we were one of 2 counties locally to receive an air quality monitoring grant for a project where communities are able to self-monitor. It's really cool. It's very innovative. So they'll be there with EPA, bigwigs and elected officials doing a little bit of a ribbon cutting situation. So Jim isn't here today to do updates. He's actually at a statewide meeting leading on some air quality issues. So we're very grateful to him for identifying the opportunity for more visibility for the work we're doing. So I'm going to stop there and open it up if you have any questions or feedback for me before I call out some of my colleagues, division directors.
Questions for Dr. Story? It looks like they're going to let you off the hook today.
Oh my goodness gracious. Thank you. And then this is just, I wanted to at least publicly put out there, some of these folks around. We had a really big presence at Public Health in the Rockies, which is our statewide public health conference. I did not get to attend, I'm so brand new, but we had a lot of representation doing a lot of amazing work. So just want to shout them out. So I'm going to turn it over to my friends. We're also, Christine is on her way to San Diego. Christine Billings, she participates and she's a leader in the NACHO which is our National Organization of Health Departments. She's a representative for us on a work group focused on readiness. So she's on her way, sunny San Diego. And so we're very grateful for her leadership there as well. So I'm going to turn it over to Joe, who's going to update a little bit on some cybersecurity stuff and some budget process updates.
Wonderful. Thank you, Dr. Story.
Yeah.
Good afternoon, everyone, members of the board. I wanted to start by welcoming Sarah Lampe again. It's exciting to see you as a member of this board. I just have a few quick updates to discuss today. First is a reminder and update around cybersecurity training. As you may recall, cybersecurity training is part of our security policy and helps reduce system breaches by providing periodic reminders around the threats to our network and reinforces the capabilities of our users. This training currently is being rolled out on a bi-weekly schedule. There are approximately two trainings that are provided to all users. That includes the Board of Health members. The time commitment for these trainings is very minimal. However, the impact is crucial. As I've mentioned before, there's a budget impact, a potential budget impact for those departments that do not meet the threshold that the county has established for the various departments. At this time, the various departments have to ensure that at least 85% of all users amongst that department, including, as I've stated, the Board of Health members, surpasses 85% of all users. Again, at this time, I'm very excited to announce that JCPH is roughly about 92% of our users are at that threshold. So we are not at risk of an additional cost for the policy, the insurance policies, and that is the first item. Is those departments that do not meet that requirement risk having to have a additional cost for the policy, for the insurance policy for the various departments. There is obviously another risk for these potential breaches, and that is, the breaches on information, the information that is shared. And that could be upwards of millions of dollars. I mean, I'm sure we've all heard those stories of other agencies, other entities that have widespread breaches. We take this, and I think it's important to take a moment to really ensure that we are doing our best, that we are taking this very seriously. Not only do we have these trainings as periodic reminders, as refreshers for staff members and for users, but there's also an effort to test the system, to test the user. So the county, as well as our health IT team, ensures that our system is as secure as possible. I will also say that, we have a very talented and amazing team amongst this department. We have our nursing staff that go through a rigorous credentialing process that revolves around electronic health record that really ensures that that information is secure and is handled appropriately. We have many other of our staff members that take this very seriously. And again, this is a lengthy process that goes above and beyond that training that is, like I said, a fraction of time, a very minimal commitment. So there's a lot of behind the scenes work that is occurring to ensure that our information is protected, that we don't fall into the trap of any breaches or any scams or spam emails, things like that. So it is critical, and I wanted to to take a quick moment to provide a friendly reminder to the Board of Health and all staff members who are part of this meeting to please go in and ensure that you are up to date with your security trainings, your cybersecurity trainings. The other item I wanted to revisit is next year's budget. At this time, the Board of County Commissioners has indeed had the initial conversation or the proposed budget meeting internally. At this time, and that is essentially a review of all of the submittals from the various departments around Jefferson County. At this time, there is not any additional guidance or any suggestions for Jefferson County, for public health. So that is very good news. It appears as though our submitted budget will indeed move into the next part of this discussion process. And that is an open public meeting that is scheduled for October 24th. So the BCC will be having a public meeting around the department budgets as well as the county budget on October 24th. If there is not any concern or any further guidance at the conclusion of that meeting, it would be expected that the Board of County Commissioner would have a hearing to adopt the 2024 fiscal year 2024 budget on November 14th. Now, that is a little earlier than previous years. In previous years, we've seen those meetings scheduled for December. So seeing it as currently scheduled for November, I think is a good relief, as a relief for my team, for all those individuals that are assisting in that finance process and the budgeting process, and hopefully to get that communication out to the rest of the department that we do indeed have that budget available for review and for utilization. So I'm hoping for a continued smooth process, but what I'm reporting today is that up until this point, things are running smoothly and on track. I wanted to shift very quickly to the fiscal year 2025 budget. There has been some conversations, and I think these conversations are still lingering, about potential adjustments or concerns around what could be in store from the county's support for public health in fiscal year 2025. And I don't want to make it seem like it's just public health that is in those discussions. It is a county-wide discussion of what could potentially be a shortfall for supporting the various departments in Jefferson County. I will say the reason why I'm bringing this up, I don't have any specific details to discuss, but I wanted to emphasize and ensure this Board of Health that this is a continual process, the continuous discussion. And I'm very pleased to say that this is an ongoing conversation that is now being part of a lot of the decision-making processes within the department. I will say I'm excited that Dr. Story is with us now, but I will say that I am taking advantage of that opportunity to re-energize that conversation around fiscal year 2025's budget. My intention with this continual cycle around this conversation is to ensure that any impacts to our fiscal year 2025 budget is the least critical for our various programs within this department. We are doing our due diligence. We are continuing this fight. We are doing everything we can to ensure that we are prepared for any adjustments to the fiscal year 2025 budget. So with all that being said, I just wanted to open it up for any questions if there are any.
Questions from the board? I don't see any. Joe, thank you very much.
I believe Lane may have a question.
Yeah.
Oh, Lane
Thanks.
has one. Sorry.
And I know we don't want to get into back and forth with public comment, but I think it's just better to clear some of the air. If there's any opportunity, I know I work in public health. I have no access to anyone's medical records. We don't track everyone's immunizations, just some of that components. Are you aware of any breaches of any information that public health has? It's unfortunate when someone is using public health's name in solicitation efforts. That doesn't mean public health had any role or that there's any connection there, but it can be perceived that way to the public. But anything you're aware of, Joe?
Lane, as I'm sure you're fully aware, I believe it's important to address all of the public's concerns. I am very grateful that there is hopefully a path to remedy whatever issue has arisen amongst the public. At this time, I am not aware of any breaches. I am not aware of sharing, selling any information. I am not aware of any delayed core requests, as I do manage to some extent really putting the correct parties in place to address any records requests. I am not aware of any delays in providing information to staff members. I give a lot of credit to our county attorney's office, how they've been instrumental in this process, and I could not do that without them. But no, I am not aware of any concerns that need to be addressed by the board or need to be shared with the public. I take that very, very seriously from a financial perspective, from a health records perspective, from a HIPAA concern. I am not aware of anything to share today. Thank you for the question.
Thanks, Joe.
Are we ready to move on?
We are.
Okay. Alex, just going to tell us about our Employee of the Month we're very excited about.
Thank you. So as Sarah said, I'm the lucky one who gets to announce and share about October's Employee of the Month, Cindy Fizel. Cindy is the lead educator in the Arvada Clinic, as well as the trainer for all new WIC Jeffco staff. Cindy has been instrumental in creating the Jeffco WIC culture around customer service and care standards in all our WIC clinics. She works individually with all new WIC staff to get them trained. Her dedication and time spent making sure new WIC staff learn policies and procedures and develop good habits shows every time we have an audit from our state office and we receive glowing reviews. Our audits over the years show that our scheduling is being done correctly to keep us in compliance. Our chart notes contain all the necessary elements and that clients are receiving the education to make the best choices for their families. The number of families she has impacted through her training of new Jeffco WIC staff, as well as serving WIC participants for the past 20 years, is astounding. She has truly touched the lives of thousands of families through her work and helped families and WIC staff to achieve their personal goals. The feedback we receive from our clients about how they attend their WIC appointments and the excellent care they receive at Jeffco WIC is also a testament to Cindy's influence on our WIC staff. So thank you and congratulations to Cindy.
Congratulations. And we will look forward to having Cindy, I'm assuming, at the luncheon.
Yes. Yes. We love celebrating our employees. It's really great. And
thank you.
Last but not least at all is Jody Irwin, our deputy director, who's got 2 updates that are very positive, and we think the board will really like them. So that's why I put Jody last. I wanted him to know he wasn't last because of importance. He was last because it, as he puts it, makes a great exclamation point on our updates. So Jody, it's all yours. Take it away.
Thank you so much, Dr. Story. Good afternoon, everybody. And also, I think being in this space on the agenda allows me to not have to talk about HIPAA or privacy laws or budget. So thank you for that. And thank you, Joe, for covering that for us as well. First of all, welcome Sarah Lampe to the Jefferson County Board of Health. We're excited to have you here. I think it was just over a year ago that I saw you at Public Health in the Rockies and had the conversation about you potentially applying for the role. So glad to have you here. And for the stadium district funding, and don't quote me on what I'm about to say as far as how the funding mechanism worked. I just want to mention this to provide a little context to the project. But when the Invesco field was first built, I believe that multiple municipalities, counties had an opportunity to invest in that project. And then when it was sold to the new ownership group here in the last year, I believe the county received a reimbursement or received some funding from that to the tune of about $1 million. And this funding had to be used for youth activities. And so over the last several months, he's done a really good job of opening up the conversation, opening up for proposals, reaching out to different departments and giving us an opportunity to apply for that funding. And so we submitted a project about youth voice. And this is really about developing a youth advisory group for Jefferson. Well, we haven't got into the details of exactly how we're going to do this yet, but a youth advisory group is one of the potential projects that we may do with this. And another project is potentially aligning with the Communities That Care group, who's doing a lot of work around youth engagement and just many other opportunities to potentially align with other organizations in the community about engaging youth in civic activities. One of the things we've seen, of course, there's research that youth who are involved in civic engagement activities have better social outcomes and, of course, better health outcomes. So really, really excited about the project. We don't have details on exactly when the funding's coming, timing on that, or what that's going to look like, but we'll definitely keep the board updated. And hopefully sometime in the next, 9 months, we'll be able to have a youth group come and update the board on the work that they're doing. But it's really looking forward to aligning a lot of around our policy programs and having youth engagement across multiple public health programs. That's the update. And then the announcement, and Elise Lubell, I think, is still on this call. So I was just told yesterday that Elise received a Lifetime Achievement Award from Colorado Public Health Association at the recent Public Health in the Rockies conference. And Elise, I'm sorry I wasn't there. I couldn't be there this year. It's one of my favorite. It's actually the only conference I go to usually every year. But I have a long list of reasons. I think that I'm not sure who submitted this for you as to why you were given the award, but I'm going to go off script for this because that's something you taught me to do whenever I have the opportunity. When you retired from Jefferson County Public Health, I think I mentioned that you've been an inspiration to many people. It struck me today when I was thinking about this that you were an influencer before that was even a word, before YouTube even existed. You have influenced and inspired multiple generations of public health workers, and I'm sure people in your personal life, I know me personally, to think differently, act differently, and see the world in new ways. I know, and I talk about this with a lot of people, you're always way out ahead of many people in regard to your thought process. You brought a lot of innovation to everything you did. I still realize today that I'm only just now understanding some of the things that you were trying to teach us all when you were here in the organization. So thank you for what you have contributed to public health in the state, to Jefferson County Public Health, and to humanity in general. So really, really appreciate you. You've taught me a lot over the years. So hopefully you wore shoes to your presentation for the award, and that's an inside joke, but congratulations and keep up the great work. I'm glad to see you here today.
And a big congratulations to Elise. She's put years and years and years into this. Okay.
That's all from us. Thank you.
That's all from you all. All right. We have a place for staff comments. Do we have any staff comments today from anyone? I'm not seeing any hands. Okay, let's go to Board of Health comments. Board members? Lane?
Yeah, thank you. Well, welcome, Sarah. So glad to have you on the board and have a full board again. That's wonderful. And if Elise is on, that's just so well deserved. It's always sad to see wonderful staff leave, but it's well deserved to retire. She's done the work, and so glad that you were recognized for that. It's the only thing I would say is that you should have been recognized while you were still working. It's should have come earlier, but again, it's so well deserved. And I appreciate the discussion today that staff have had and sharing. So appreciate all the staff work every month. Can never say that enough.
Anyone else? Harriet, it looks like you're getting ready to unmute.
Yeah,
or finding your button. There you go.
I think that Sarah had her hand up first.
Oh, Sarah's got her hand up.
Yeah, I want to reiterate all the great comments about Elise. I was actually at Public Health in the Rockies and sat at the table with her and her partner for the receipt of the award, and it was lovely to see the pride in the family and of all, both in the Jeffco family and her personal family. It was lovely, and it was, I always find that the naming of the Lifetime Achievement to be so odd, given that Elise still has such a lovely life to live beyond work. And so I am excited to hear and understand the disruptions that she has in life beyond work at Jefferson County. So congrats, it was very well deserved. And it was an honor to sit at to share a table with her during that award ceremony.
Thank you. Harriet.
I want to echo congratulations to Elise. I had the opportunity to work with her back when I was working, and hope she's enjoying retirement and getting to do some of the wonderful things like I'm getting to do in my retirement. So I also want to extend a thank you to Sarah. This is the Dr. Story, Sarah. For not just my copy with her yesterday, which was great, but for her report today, which I think gave us information that helps us to kind of get our head around some of the policy issues like equity, that we as a board ought to be very invested in and figuring out, how to provide guidance for the organization with. So, because I do think that that's our role. And I think that, like during the pandemic, there was like not much chance to do that kind of work. But I would really like to see us figuring out the areas of community engagement and policy together, figuring out how to help the community to understand those kinds of issues, and understand the policy underpinnings behind procedures that the department then sets up. So thanks. That was a really good foundation. And I look forward to your reports in the future being just as edifying.
Thank you, Harriet. And I would completely agree with everything that everyone has said. One of the comments, Harriet, that you just made, I think it's really important and exciting to see that, that there could be a really great partnership between Dr. Story and the board, and how we all can work together. In the experiences I've seen in the past, it's better to be able to get out into the community and to let them know exactly what we're doing and exactly what, the department is working on, et cetera, before something happens. Because if you do it after something happens, then you're in reactionary mode. And that's never a good place to be. So I appreciate that. And Elise, people just cannot say enough about you. You've put your life into all of this, and you have been a great mentor for so many people. We truly, truly do miss you, and can't thank you enough for all the work that you've done, and all the staff. Again, we have got probably the best health department staffs that an organization can ask for, and I hear that across the board. I hear that from other health departments. So the only other thing I will add is, please don't forget that we have our Employee of the Month luncheon the 24th, this next Tuesday. And if I can ask the board members to be sure, if you're going to come, which we love when all of us can be there, to let Lindsay know, so that we get a really good head count of how many people are going to be there. So with that, I have nothing more. Does anyone have anything else they would like to add? Okay, then I guess we will adjourn the Board of Health meeting, and we do have an order to go into the executive session, and I will ask Carrie if you will take us into that, please. But we are adjourning the regular Board of Health meeting at 5:17 p.m.